Welcome to My Best Save, the podcast where the world's top surgeons reveal their most extraordinary moment in the operating room. Get ready for gripping stories of life-saving maneuvers that defy the odds. I'm your host, Dr. Jeremy Nikfarjam, a board-certified plastic surgeon in New York City. Discover the secret to surgical heroics that become legendary educational cases. See you in a stitch. Okay, my people, Dr. Jeremy Nick, plastic surgery. Welcome to My Best Save, the podcast that's about describing amazing, miraculous saves by doctors and healthcare heroes. Featured by the one and only, your true host, Dr. J. Nick. Thank you for following, guys. Make sure, tell all your friends, tell all your family. If you're driving, if you're taking a train, a bus, if you're in a classroom, if you're at work and you want to sneak out a little bit, this is a quick podcast. Each episode, we're going to highlight an amazing save. Now, I'm going to tell you about a story that brings me back to my younger days when I had hair and I was vibrant and I was just, grr. I was a resident in the Bronx, and many, many years ago, I was on call. Now, imagine in your mind, you're a young doctor, a young surgeon. You're now coming to your specialty, which is plastic surgery for me. And on my second plastic surgery call, I'm up again. Now, when you come into call, this is not like checking into work. You're bringing the anxiety, you're bringing that sort of like that ferocity. You're coming in with adrenaline pumping through your veins. I mean, you're like a soldier coming to war. You're ready to go. So our calls were a mixture of covering 4 or 5 hospitals within 6 miles of each other. But these hospitals were not your small little hospitals. These are huge coronary center hospitals, children's hospitals, adult hospitals, women's hospitals, and other trauma centers. And we were each one resident on call covering this whole entire campus. And the call started at 7 p.m. and ended at 7 a.m. Now, we didn't start our days at 7 p.m. We started our days at 5:30 a.m. with morning rounds, went into 7 o'clock start of call till the next morning at 7 a.m. And we didn't go home after 7 a.m. We started the next day right through it. So calls were intense, they were draining, and they were really important. When you look back in time, you realize how much you grew, how much you matured, how much you learned being under fire and being on call. So one day I come into call. It is a nice, beautiful summer afternoon. I take over call from the daytime teams, getting sign-on report from all the 6 campuses. Hey, we have a patient here with this, we have a patient there with that. Make sure you check on this patient tonight at 2 a.m. Make sure you see that child at 11 p.m. onwards and onwards. And we made a running list from all different campuses of all the patients, all the ones who needed probably more attention. Now, I'm on call, my day's going by, I get a laceration at the children's center, a burn at the burn unit, the bread and butter things that come to the emergency rooms, gunshots, wounds, stabs. These things were normal. I mean, it was like every day. So I am now running between hospitals, and I get a call from one of our trauma centers, and they say, "Hey, are you on call?" And I'm like, "Yeah, I'm on call. What's going on?" Say, "We have a patient coming in that we need your urgent attention to come to, and they're going to be arriving here in about 26 minutes." And I'm thinking, 26 minutes? That's so specific. No ambulance gives that kind of sort of directed, specific information. That's odd for plastic surgery. It's not like, God forbid, their heart stopped. It was more of a plastic surgery problem, right? I'm plastic surgeon on call. So I tell them, "Listen, I'm busy. I'm going to this hospital and I'll take care of something. Let me know what you think when they get there and I'll meet you after I finish my work." I get a call 10 minutes later saying, "Hey, where are you? Patient's arriving in 16 minutes. Now I'm wondering, what's up with this? What's 16 minutes? But what I heard on the phone call was the director of the emergency room, who was kind of like the boss at the time, is saying, "I need you to come here now." So like a good resident, what do? I drop what I'm doing, make a U-turn in the middle, Pelham Parkway in the Bronx. If you know the Bronx, you know what I'm talking about. And I zoom towards this trauma hospital at 11 something p.m. As I'm pulling in to the driveway going up all the way to the ambulance bay, my car Now, I had a $4,000 red Mini 10-year-old car, the biggest piece of crap in the world. I absolutely loved it. This car was tiny, it was small, perfect for me. And as I was driving up this ramp, instead of my car going forward, it was moving sideways. And it was shaking like a T-Rex, slamming the ground with its feet. And what I noticed is I look left, I look right, I don't see what's causing my car to move. And I look up and I see an enormous helicopter that's landing 50 feet away from my car. I'm struggling, I turn, I can't drive this car anymore. I just pull right into the ambulance bay, park the car, get out, because I obviously can't drive this. And I'm watching in awe a helicopter land with a medical team on board. A man in a stretcher comes rolling out, and this 4 or 5 person team is escorting this man who's sitting upright, yelling in pain, but yelling, having what we call normal airway. He's able to speak, being carted into the trauma bay in the emergency room. And I naturally follow. So as I follow in, I come into the trauma bay, and this man is yelling, screaming, saying, ah, going crazy. Now, in the world of trauma, if a person's able to speak and able to talk, their airway is open, you probably know the heart's beating okay, and you kind of know overall they're what we call stable. We don't know, but this is a sort of, obvious eye exam, just scanning by eye. He gets connected to the monitors, and I'm right, he is stable. But he's holding his leg, and he's yelling, and he's screaming, and he's shaking in pain. So I ask the transporters, the EMT transporters from the helicopter medevac unit, I said, what's the story? They tell me 62-year-old man was taking care of his horses in southern New Jersey. Now we're in the Bronx. And all of a sudden feels a sharp stinging sensation in his leg that has become worsening in pain, more severe, non-intermittent, meaning it's there the whole time, it's constant. And he's now experiencing numbness in his leg. And I'm waiting, I'm thinking, well, what does this have to do with plastic surgery? And I asked, well, what caused this injury? Was this a burn of some kind? They go, nope, we have a high suspicion that was a rattlesnake bite. Now I'm wondering, well, they probably have the wrong guy, because I am not a trauma surgeon. I used to be, not anymore here. I am not an ER doctor. I'm a plastic surgery resident. Why are they calling plastic surgery for a rattlesnake bite to the leg? That makes no sense. So I kind of look left, I look right. I talk to the ER director. I'm like, hey, doc, listen, I think there's a misunderstanding. You probably need the trauma team. I'm on call at 6 hospitals. I have a young child I have to tend to. You got the wrong guy. I think you should call the right guy. And this ER doctor says to me, I've been here for 32 years. Every single snake bite is managed by you guys. Now, when you sign up for a plastic surgery residency, you're thinking, I'm doing burns, I'm doing cuts in the face, car accidents, people with cleft lip and palates, boobs, bodies. You're not thinking snake bites. I mean, that's not in your common sort of thought process, right? So I immediately had a distrust of what's going on. And I have absolutely zero knowledge of how to treat this. So what do? It's now midnight, and I call my chief resident. Your chief resident is kind of like your boss. It's who you report to. It's who's supposed to steer you in times of need, which is exactly what this instance was like now. So I call my chief resident, and we're going to call him Dan. I'm like, hey, Dan, it's Jeremy. And he says, what do you want? I was like, hey, I have this guy in the ER. I think they have the wrong service. It's some guy being helicoptered in. I don't even know why they're helicoptering in to here because he had an injury to his leg. He goes, what kind of injury? And I say, he has some kind of a snake bite. They think it's a rattlesnake bite. And there's a pause on the phone, and Dan goes, oh, well, no, they're right. We are the ones taking care of rattlesnake bites. And I say, I'm like, Dan, listen, I don't know anything about snake bites. What the hell? We don't even deal with the feet anymore. What is a rattlesnake bite of all things? I'm like, this is not for me. I don't know what to do. And he said to me, fear not, my friend. Give me your email. I'm going to email you exactly what to do. So we exchange emails. I get off the phone. It's midnight. And all I'm thinking is, oh, what a relief. I'm going to solve this problem and just move on and be done with this. So lo and behold, an email comes in. I grab my phone, open the email, and I see an attachment, and I kind of blink my eyes to look at it properly. This wasn't 1 page, 2 pages, 3 pages. It was an 84-page attachment. Chapter 1, the creation of the Snake Bite Center of the Tri-State, founded by a plastic surgeon in the 1950s. And all I'm thinking is, dude, I have no time for this. Like, please, I can't go through history right now. This man's leg's gonna fall off. And on top of that, I can't believe a plastic surgeon started this. He royally screwed us over. So I kind of fast forward. I call back Dan. I'm like, Dan, listen, buddy, I can't go through an 84-page, report of what to do. Buddy, can you tell me what to do? And he says to me, tough blank. Couldn't finish the sentence there. Tough, tough whatever. Figure it out. Hangs up the phone. Now, this sounds surprising to anyone who'll be in my shoes, but not to a surgical resident. It's kind of trial by fire, and you expect to be fired upon. So what do? I start scanning. I do what I do best. Go move fast, make fast decisions. And I land on a page of the protocol. And I say, okay, examine patient. Well, I didn't do my exam properly. Went back to the bedside, examined this man's leg. From the time he came in to now, about 30 minutes, there was a redness that started at his toes and his ankle where these 2 penetrating marks were. And now this redness traveled halfway up his leg by his shin, and his foot was turning rock hard, and the leg was turning really swollen and very painful. He was what was developing, as we call, a compartment syndrome, where swelling in the leg can choke off the blood supply to the leg, eventually leading to the need for amputation of that part, which is the leg now. So I'm looking at this and I'm saying, you know what? There is no way medicine's gonna help this guy. So I go back to this protocol. I start moving faster. I'm sweating. It is hot in here all of a sudden, and I'm alone on an island, and I have no idea what to do. And people around me have no idea what to do. They're all staring at me. Yours truly here. So I kind of come by this protocol, and I say, okay, examine the patient, check labs, perform X-ray, CT scan if necessary, check for pulses. I did all this stuff, right? And then I get to one big green box that says antivenom. And I said to myself, aha, we need antivenom. Makes sense. So I proudly walk my way over to the ER. I part the C's. I go to the ER director, an older man, the man I was talking to, and I said, Doc, we need antivenom. And he looks at me and says, okay, so go get antivenom. And I'm thinking, well, okay, well, we're going to call pharmacy. I get on the phone. I'm like, hey, pharmacy, we need antivenom. And pharmacy goes, okay, hold on 1 second, punching, letters on the keyboard. Hold on 1 second, hold on 1 second. We don't carry antivenom. So I'm like, what do you mean you don't carry antivenom? No one else here has medication. You're the pharmacy, you're the central pharmacy. All medications of every kind are stored in the central hub of pharmacy and are distributed out to the hospital, every nook and cranny of the place. And you have to order it from the pharmacy. So I say, well, are you the pharmacy director? He says, yes. I'm like, well, where can I get antivenom? I need it stat. He says, oh, very simple. You have to call the place that makes antivenom. And I say, well, where is that? He's like, I don't have to figure it out. Hangs up the phone. So I'm thinking now, no one's helping me. And I'm thinking now, that booklet is way more important than anyone else that could do for me. So I go back to the 84 pages. I'm on page, 30 something. Start scanning through. I follow that box of antivenom, and I follow, and I see one word attached and one number, a guy's name, and an actual 718 phone number. So I call this number, and it says 24/7, and I call, and I'm like, what the heck? And I call, and I wait, and some man picks up the phone, and he says, hello? I'm like, hi, I'm Dr. Jeremy Nikfarjam, plastic surgery resident. I need antivenom. Are you the antivenom man? And this man, and I'm thinking he's gonna say, who the hell are you? This is midnight. Who calls someone at midnight asking for antivenom? This is a prank call. And this man just pauses on the phone and he says, I'll meet you in 20 minutes. I'll have your antivenom. And I'm like, sweet. Hang up the phone, prop up my chair. I'm like, I got this, right? I'm gonna handle this. In the meantime, we're handing bags of IV fluid, we're hanging antibiotics. We have this man, his legs elevated. I go to him and say, sir, we're gonna save your leg. And the back of my mind, I'm thinking, well, I better prepare for it. This doesn't work out properly. But either way, I got this handled. So I then begin to realize, well, the antivenom is not in the pharmacy. Where do I go? So I call the number back. And I'm like, hey, my friend, I just called you about the antivenom. He's like, yes, I told you. Give me 15, 20 minutes. I was like, okay, where do I go? And he says to me, come to this address at this time and call me when you get here. And I wrote down the address. It was some numerical address, like all New York City addresses are. So I get in my car, I put it into my app, it showed me some random location, and I get in my car and I start driving, and this is dark. You know, it's not the most safe. You don't be driving in the middle of the Bronx, unattended, in the street. I'm thinking, wow, is this some kind of like shady location? So I'm driving, and I actually see that I'm approaching the destination, and all I see is a huge long block of extremely tall iron gate fences and a big sign that shows destination star marked. And I look up, and what does that sign say? It says the Bronx Zoo. And I'm like, holy cow, I'm at the Bronx Zoo. So I call this man, I say, sir, I'm at the address you sent me, but I think there's a mix-up. This is the zoo. I'm treating a human. I'm not a vet. I'm a surgeon. I'm a human surgeon. And they're like, no, sir, you came to the right place. Just give me a minute. I'm going to open the gate. You're going to come in. I'm like, where are we? He's like, you're in the Bronx Zoo. So I have no fear. I'm on the clock. If I don't go back in time, this man's leg is definitely coming off because this thing's traveling fast. So I'm waiting. All of a sudden, this gate opens up, makes the loudest noise. You can tell it's being opened manually by some guy. I get my cell phone flashlight, I shine on his face, and I see this little man saying, doctor, come with me. And he's walking me through the zoo in the middle of the night with like one little light on, walking through acres and acres of property unattended. All I'm thinking is, this man's throwing me in the lion's den and I'm dead. Like I'm the feedings for these animals tonight. So we're walking through. We finally get to a nice quiet little room. He opens the door, starts moving things around, ruffling through things, and hands me a bag and says, here you go, doc, I'll see you later. And I look at him, I look at the bag, I open the bag, it looks like an IV bag, it's really big. And I'm like, thank you. And I just get in my car and I get the heck out of there because it was scary as hell. I zoom back, drive up the ramp, park in the ambulance bay again, walk in the trauma bay, and I walk in like I'm Moses leading the people through the desert. And I'm like, I am your savior, people. Here is the antivenom. And as I held it up, everyone stared at it. The nurses were like, wow, you're the best doctor in the world. The residents were like, you're going to save this man. The patient's like, doctor, I can't thank you enough. And I'm like, well, it was nothing. I just went to the zoo to pick up this antivenom. And as we're going to hang it, the ER doctor, that ER director, who's like my sort of kryptonite here, he says to me, well, doc, how can I give this antivenom? I'm like, very simple. You stick an IV in and put it to the patient. And he says, no, doc, there is no label. I'm like, label? He's like, yeah, you need a label. I'm like, I can't go back, buddy. I can't go back to the zoo. We got to send someone else because I don't have time for this. And he says to me, no, you can go to the pharmacy. I'm like, okay. I go up to the pharmacy, bring the bag, labels the bag comes down. Now I'm like, antivenom. As they're hanging this antivenom bag, this man's leg went from light pink to red to light to dark red to purple up to his knees. And all I'm looking at, when I touch his leg, he jumps and hits the ceiling. All I'm thinking about is, this is not going to work. This is a compartment syndrome. This leg has to be amputated. So as I hang the antivenom, like all surgical residents, I prepare for the worst. Leave the bag, leave the team. I go up to the operating room, and I actually call the vascular surgeon on call, and I say, doc, here's the situation. I might need you on standby. I'm booking the operating room. If this leg gets worse, we have to amputate or else this man's going to die. And the doctor says, of course, you let me know. Patient now goes on standby in the OR. I go down and wait for this patient to be treated. IV bag is now going for about 30 minutes. 30 minutes becomes 1 hour. I go to another hospital. I come back real quick. He seems to be stable. I take care of my business. As I come back 90 minutes after the antivenom bag is going, the bag is now almost finished. That redness has receded by 50%. We're from middle leg to lower leg. Amazingly, that calf is soft. What was rock hard now is soft. And I'm saying to myself, not wow, the antivenom did this. Not wow, the patient's immune system is so amazing. I said, well, I saved this guy's leg. You know, go me. The stupidity of my confidence, right? So I march out of there. I'm like, yeah, his leg's gonna be fine. We're okay. You know, fight till tomorrow morning. He's gonna get me to the burn center. I walked out like a hero there because I was really confident he's gonna get better. Well, lo and behold, I go about my routine, go around at other hospitals, and I get a call an hour later saying, Doc, it's getting worse. You gotta come back. I come back, and that redness that receded from below his knee almost to his ankle has now come back up. Like the tides of an ocean. It goes up and comes down and went right back up again. And the pain came back and the hardness came back. And I'm thinking to myself, this is not gonna work. He has to be operated on. The operating room has to be activated. I don't want him to die on my watch. The goal of a good surgical resident is to keep your patients alive until the morning. That's the goal. No one dies on your watch. No one gets sick, as we call it, on your watch. So, lion-hearted, I go up to the OR. I get the case mobilized. I'm calling in the surgeon, and I go to the ER doctor and say, you know what, doc? Before we operate on this gentleman, let's get another bag of antivenom. I then call the pharmacy, and what does the pharmacy say? Doc, you gotta get me more antivenom. What do? Call my friend the Bronx Zoo. I get in my car. This time, in and out, 3 minutes, boom, boom. I knew exactly where to go. Said hi to the gorillas, said hi to the insects that were in the cages, got the antivenom and jetted the heck out of there. Got back to the hospital, put the label on. I'm like an expert, right? I did it already. Hang the bag, and this leg once again came down and down and down and down. This happened not once, not twice, but 3 times from midnight till 6 a.m. During these 3 times, during these 6 hours, I sweat bullets. I have lost 10 years of my life. I was exhausted covering other emergencies, disasters at other hospitals. And at 7 a.m., when that rooster starts, you know, sort of making its noise in the morning, I forgot what they call it. And when I see my surgical team walk in the morning, and I'm, you know, sprawled down on the ground after being drained all night dealing with this man's leg, the second I see them, you know what I do? I stand up, wipe my sweat off my face, prop myself up, and you know what they say? Well, how was your night, buddy? Did you go okay? I said, oh, it was easy. It was no problem. This man came in with a rattlesnake bite. I got the antivenom. I saved his leg. It was no big deal. But let me tell you what the guys to do. Just call the Bronx Zoo. They'll get more antivenom from you, and he'll be fine. And by the way, someone booked the operating room. I canceled it. He really didn't need it. To add some comedy to fear, I'm embellishing the story a little bit, but lo and behold, 3 days later, 3 full days of antivenom use and FFP and other cryo agents, maximizing use of our blood bank resources in the burn center, we miraculously had this patient walk on both feet out of the hospital. What I learned was that our hospital was a snakebite referral center of the tri-state for almost 50 to 60 years. We pioneered the highest level of snakebite venom treatment around the whole almost East Coast. And I was lucky enough on my second day of call to handle what was to be one of the most complicated snakebite injuries that they've ever seen in years, because rattlesnakes were not indigenous to that area. So yours truly here, lo and behold, saved the man's leg without knowing it, and I basically wung it until I figured it out, but now I'm a snakebite expert. Tune in for our next episode of My Best Save. Thank you. Cool.